Welcome, everybody. This is Jennifer Greene, and I'm coming to you from AppHealthCare. We are the public health department serving Alleghany, Ashe, and Watauga counties. And we're here today to talk with two local medical experts from Alleghany County, specifically Dr. Rich Ambler from Alleghany Family Practice and Dr. Jessica Ange from AppHealthCare. And we are here to talk to you a little bit about COVID vaccines. In our role as the public health department, we look for opportunities to control the spread of COVID. And thank you to all of you who have gotten a shot in your arm already. We want to see more of our community protected, particularly those who are at higher risk for severe illness. And so today we're hoping that this little segment will give you an opportunity to hear a little more from these folks and just answer some questions that you might have about vaccines in general. But I wanted to just start by saying, you know, we're at 44% of Alleghany County who have received at least one dose of vaccine, which is really terrific and actually shows the great progress we've made together with many of you and so many volunteers and our partners at Alleghany Health. So we're happy about that. But what we know is that until we get a higher percentage of people in the community vaccinated, we're going to continue to see more COVID pop up in the community, particularly in different places where we might see more vulnerable people be exposed. And obviously, all of us, not only do we want to ditch our face masks on a regular basis, but we want to get back to normal, back to enjoying time with loved ones and doing the things that we enjoy so much. And that's a great progress that we've made so far, and we want to keep that. So I'm hoping today we can start by just getting these two experts to talk to you a little bit about vaccine. And some things we want to cover include maybe some common myths that you've heard, or perhaps help you answer some questions about the vaccine in general. So I'm going to kick it over to you, Dr. Ange, and let you start, if you don't mind. Tell us a little bit about your thoughts about vaccines, about the COVID vaccine in particular.
Sure. Yeah, so I think that in thinking about, you know, encouraging folks to get this vaccine and kind of getting back to pre-COVID normal, I kind of think about getting the vaccine in a couple of different ways. You know, I think on the one hand, it is super important to protect our individual health. So we know that anyone can get COVID, whether you're healthy or have underlying health problems. So, you know, we do kind of have a lot of questions about whether someone who is in good health, whether they should get a vaccine or not. And we definitely encourage all folks who are eligible to get one, because it can protect you know, your individual health. We've seen folks from all spectrums sick with COVID, you know, in terms of having complications, being hospitalized, death, that sort of thing. So just, and that can affect any type of person, whether you're healthy or have underlying health problems. Certainly there's higher risk with certain conditions, but I think that anyone, you know, could potentially get it and have a range of complications. And now we're also seeing this kind of emergence of concern about longer term symptoms with some folks, like the long COVID complications. So all that to say, you know, I think one way in thinking about the vaccine is to think about protecting your individual health. And then the other way to think about it, or kind of two ways together, would be thinking about the health of our loved ones in our community. So, you know, even if you are a healthy person who is not likely to get super sick from COVID, you can still transmit it to other folks who may get more sick or end up hospitalized or dying or with long-term effects. So in thinking about protecting folks who can't be vaccinated yet, or, you know, our community as a whole, I think that in that sense, the vaccine is also the best tool that we have to protect our loved ones and our community, and to try to get back to a place of kind of normalcy, or what we were doing pre-COVID.
Thank you. And I'll just add on to that. Anything that you would say to those women out there who might be concerned about fertility challenges, Dr. Ange?
Yeah, so I know this has been a concern for many folks, and thus far, there have been women in the clinical trials for all of the COVID vaccines that have become pregnant after vaccination, and there haven't been any safety concerns or safety data to suggest that the vaccines impact or alter the ability of a woman to get pregnant. And no concerns for children of women who have the vaccine and then become pregnant either. So I think that it's recommended across the board for, if you're pregnant now or hoping to become pregnant in the future, to get a COVID vaccine to protect your health and the health of your children as well.
Thank you. Dr. Ambler, I'd love to have you weigh in at this point. What are you hearing from your patients, and what do you think folks need to know about the COVID vaccine?
As far as reasons why I think healthy people should get the vaccine, the studies are clearly showing that those who have immunity from the vaccine have a stronger, longer lasting immune response than those who have acquired immunity from COVID infection. Looks as though right now, antibodies that remain in someone after being infected with COVID last about 3 months. And those who have the antibodies from vaccination, as of right now, have those antibodies for at least 6 months. It's probably going to end up being longer than that, just because there hasn't been as much time from the start of vaccination to totally accurately measure how long that immune response will last. But it is very clear that the immune response is stronger from the vaccine than from getting infected with COVID. So that in and of itself is a strong reason to get the vaccine. As far as safety, that's a common thing I hear from patients: is the vaccine safe? It was developed really quickly. I don't know if I trust it. I want to wait and see how things play out over the next months to years to see if it's safe for me. What I usually tell folks is that the science behind this vaccination did not start on January 1st of last year. This technology has been in the works for decades now, this new vaccination technology. And just like any other aspects of technology in our society, things happen quicker, faster. Internet connectivity being one of them, telecommunications, and medicine is one of those as well, where things develop faster and better. The vaccine still has to go through the same safety regimen checkpoints that are mandated by the CDC. The technology, from a clinical standpoint, makes very good sense. It is very safe. I have no qualms that we'll give this to our children whenever it's approved for them, and I just have a lot of trust in the technology behind the vaccine, and I again can't recommend it enough to anybody.